I'm Dr. Raji Anand, GP partner and trainer at Yorkshire. And this is a program which we are trying to create awareness towards the NHS vaccination program. Thank you, Kamala, for having joining us on this program.
Hello.
Hi
So,
there.
so Dr. Anand, I think one of the key things that people certainly ask me in the NHS is, what are the different types of COVID vaccinations available in the NHS?
Yeah, it's a very relevant question. We've got 3 vaccines at the moment, Kamala, and the first and foremost is the Pfizer-BioNTech vaccine, and this was a vaccine that was given approval first and foremost in November-December period, and this is a vaccine that has to be stored at really extremely low temperatures, and thereby it has to be stored at hospital hubs services. We've got the other vaccine, which is the AstraZeneca, the Oxford vaccine. Since that vaccine has been available, we have managed to ramp up the vaccination program, and we are in a position to offer it to, and we have been offering to all the care home and the housebound patients. The other third vaccine that we have is the Moderna, which is yet to be really available in a large scale. And given that the supplies have been going up, we are able to have had almost 1,500 vaccination services available all over UK. And that is where we are at the moment. And we have over even the last week, dozens more services are available at the moment to provide vaccines.
Now, these vaccines have been developed extremely quickly, and I know some people are concerned that they might not be completely safe, seeing as they've been developed so quickly.
Yeah, I know that has been, you hear about it a lot in the media too, and probably an understandable concern too. But the vaccines that have been administered by NHS have gone through rigorous assessments by the world leading MHRA, which is the organization which ensures safety for each and every medication we take on everyday basis. And thereby, there is clear transparency and there is reliable data to believe, and we know for sure that these vaccines are safe. And also, there are a few other factors that has helped to enroll the vaccines in such a short scale. These are, over the years, we have accumulated a lot of research regarding the related viruses, which has helped us to develop these vaccines. And also the methods by which we have managed to develop these vaccines have also, over the times, we have improved. There's a large amount of global funding that has been available, and that has certainly made things a lot more easier for the firms to run the parallel trials side by side and ensure that which we might have taken years to achieve has managed in a short scale. And moreover and above, there are hundreds and thousands of volunteers who have offered themselves for these trials, wherein in the past they used to be, we have to recruit on an individual basis, and that always took a lot of time. So it's been an exceptional journey from research to reality, and we have made tremendous progress, and it's a remarkable achievement.
Certainly makes me very proud to work in the NHS.
Oh, certainly, absolutely. And I'm a vaccinator myself, and the amount of positive feedback each and every session that I give vaccine is so heartwarming. I have had patients who have been isolated since March, April months, who have just come out just for the vaccine, and they feel they have given a new life, new leash of life. And honestly, it makes me tear up at times when they get the warm kind of reception you get from them. It's been absolutely marvelous.
So, I mean, at the moment, we have been vaccinating some of the oldest people in our communities, some of those with the most vulnerabilities. But if you're young, fit, healthy, and you feel like you might not be at much risk from COVID, why should you have the vaccine?
Yeah, again, it's a very important question, because vaccine is the best route that we can get back to normalcy. What we had previously is the best way that we could possibly achieve is through vaccination. And this is because of numerous reasons. One is it not only offers a personal protection, clearly it has shown dramatic decline in the severity of the infection, and thereby it prevents hospitalizations and also serious infections that have led to death, very sadly. And in fact, we do know that the vaccines that are there over the years commonly do not provide 100% immunity or complete immunity, but what they definitely do is give us protection. Thereby it prevents any serious infections, adverse illness that are caused by these infections. And it is too early to know for sure whether COVID vaccines can give us all the protection, but we certainly know, however, that they have shown dramatic reduction in the symptoms and the severity of the infection. And thereby when the symptoms reduces, for example, the coughlets and the droplets that are transmission reasons for the infection to spread in the community, when that reduces, clearly the infection spread in the community will come down. So this is what we could talk about herd immunity as well. And over and above, we do know that not all fit and well can 100% recover. We know that we are clearly seeing a pattern of something called as long COVID now. And so people who have been absolutely fit and well, unfortunately, before what had the COVID, have now been riddled and debilitated quite significantly. And thereby, again, it is very important to be aware that not every fit and well individual can recover. And moreover, we have got the new vaccine, which is the traits of the variants that are coming together, and that in itself is also affecting the fit and well. And we do know that the vaccines that we have now are giving us good, quite significant efficacy against these new variants as well. So there are several important factors that, yes, in each and every individual of us, when we are offered a vaccine, we should take it up.
Now, there is also evidence that there are people from Black, Asian and minority ethnic communities that are less likely to have the COVID vaccine. We've got some data within the NHS that shows certain people within these communities have greater hesitancy than others, and also some data to show that actually uptake has been a bit lower in some Black, Asian and minority ethnic communities as well. Why do you think that is?
Yeah, that's a bit of a worrying trend, and I think it seriously needs to be addressed as well. The Black and Asian ethnic minority sadly have been quite disproportionately affected due to COVID. And in fact, they are the people who should be resorting to the vaccines. But unfortunately, there have been quite a lot of false misconceptions about the vaccines that have been propagated, possibly through social media. They get to hear that these vaccines can actually cause them harm. There are also the concerns about that they have been rolled out too soon, and thereby are they safe, which we earlier on discussed about. And not only that, they also concerns about it can possibly affect fertility, and thereby there have a lot been misleading information that is out there through possibly WhatsApp and various other social media channels, which has made them quite nervous, made them quite anxious to take up vaccines when they are offered. And not only that, historically, over the years, we do know that there are other issues that could be possibly contributing to this. The Black and ethnic Asian minority people, due to possibly language barriers, there could be cultural issues, and this could be at times compounded by socioeconomic factors as well, that they do hesitate to kind of get the services that they should, that they are eligible for. So thereby it's very important that in increasing awareness and making sure that public health information is propagated, thereby they can feel reassured by it, and thereby they are that what are they eligible for, they should be taking up in full-hearted faith as well.
Absolutely. And so you alluded to WhatsApp and social media. There is so much misinformation flying around. We all hear things from all kinds of people. How should people find information that they can rely on?
Oh yes, exactly, because it is so important to be, because obviously when it comes to vaccines or any treatment options, or for that matter, it is important that you get it from the relevant source. And NHS, the vaccine is being delivered and managed by NHS, and the NHS is an organization that people can very much rely on. The information that is coming from NHS is accurate, and thereby it is very important that people go to the right resources to access information. You can be assured that the information that they access is reliable. In the social media, it could be Twitter or Facebook, if there are blue ticks to it, if ensuring that there are organizational tags to it. And thereby, if they get any information through the WhatsApp or through any other resource, it is always important they log on to the NHS UK website, which will signpost them to the reliable, accurate information. And thereby they can ensure that they are not misled by any communication that they are receiving.
Absolutely. Thank you. So you alluded earlier to some concerns that people have had around fertility. Also, I think if you're a pregnant person, how do you make the decision over whether you should have the vaccine?
Yeah, I can certainly understand because that is a common asked question. And clearly pregnant women, particularly if they are known to have any underlying health problems, are at serious risk of COVID infection. And thereby MHRA has recently updated their guidance, and they have clearly said that pregnant women and breastfeeding moms can take up the vaccines. And they have large number of women who are both pregnant and breastfeeding have taken up the vaccine so far. And clearly there are no serious adverse effects that has been shown. And thereby, if women have concerns, the NHS recommends that they contact their GP or their midwife to get the reliable information to ensure that they can take up the vaccines. And not only that, these concerns about fertility that kind of has been circulating around and unfortunately has caused some serious concerns and worries. And this has been well looked at by the Royal Colleges, both of the obstetricians as well as from the midwife teams as well. And there has been no plausible explanation or any evidence to show that fertility can anyway be compromised by the vaccines. So clearly people can take up the vaccines without having any worry whatsoever, because there is no evidence to show that it compromises fertility in any way at all.
That's a really important message, I think. Definitely. Just for everybody. So I said we've vaccinated so far a lot of those people who are in the older age ranges or who have underlying health conditions. Who's next?
Oh yes, of course, because as prioritization groups, we started off with 65 and above and the clinically vulnerable. And now that we have covered vaccination for majority of these people, the next will be the fitter and the younger population who will be invited for the vaccine. And so they will be receiving their communication letters. And once they receive them, then they can log in onto the vaccination site websites, and thereby they can take up the vaccines at a place nearest to them. That would be the next step forward, which should be upcoming in the next few weeks.
Lovely. I'm looking forward to receiving mine.
Yes, absolutely. Because as a frontline worker, obviously I have received them, but I think it is very important as the program, as that is what we are aiming, that the whole population, hopefully in the months to come, we will all be vaccinated and we'll be raring to go.
Oh, absolutely. I've been lucky enough to be working from home, but I'm very much looking forward to being able to hug my mum again.
Oh yes, definitely. Yes, I think that the most important news is it's not only normalcy. We should be able to hug our loved ones, the elderly parents and so on, who have been secluded and who've been so very socially isolated. I think this is the best option